Good morning, good afternoon, good evening, and wherever you are across the globe, welcome to this last webinar of the Culture and Health webinar series for 2020. My name is Felicity Thomas and I run the WHO Collaborating Centre on Culture and Health, which is based at the University of Exeter in the UK. And we work closely with the WHO Regional Office for Europe Insights Unit and the Cultural Context of Health and Wellbeing project. The webinar you're about to listen to and hopefully participate in is part of a series which is funded by the Wellcome Trust and is the product of a collaboration between WHO Europe, the Collaborating Centre on Global Health Histories at the University of York, and the Collaborating Centre on Culture and Health here at the University of Exeter. The webinar series examines important and timely topics at the intersection of health, wellbeing and culture. And we intend to create a forum that brings together experts from the humanities and social sciences, as well as senior officials from WHO and other UN agencies, voices from NGOs, think tanks and civil society, and of course the wider public, to exchange ideas and perspectives exploring the social, historical and cultural contexts of health. During this webinar today, our panelists are going to spend the first 30 minutes or so making brief opening statements about today's topic, which is on loneliness amongst young people. The remaining 30 minutes will be dedicated to a discussion, including questions from you, our online audience. If you'd like to ask a question, please go to www.slido.com and enter the event code, which is #WHOCH, and you'll also be able to vote other questions up or down on that. Please be aware that we also have a questionnaire up on the Slido page, which helps us to evaluate and improve our webinars. So please do take the time to fill this out at the end of the webinar. And if you'd like to be kept informed about our webinar series, please also leave your email address so we can get in touch with you. With that being said, I just want to say a few words about today's webinar. The event has been organised in a year where the problem of loneliness has really been brought into stark relief by the COVID-19 pandemic. Now, we often associate loneliness with older people, but evidence is increasingly showing that young people are also very adversely affected, and that this can be particularly evident during times of transition, which are quite often times associated with independence. So, for example, when people leave home or when they start work. Today, we want to consider how a cultural context perspective can help us to understand what's happening and how we can help identify ways to move forward for young people. We've got three really fantastic speakers today from different backgrounds who are going to tell us about the ways that loneliness is inherently cultural, how schools across the region can play a role in reinforcing or combating loneliness, and the ways that innovative approaches are being used to help address the problem of loneliness. So I'm going to briefly introduce our speakers one at a time before they talk. And to kick us off, it's my pleasure to introduce our first speaker, Fred Cooper. Fred is a research fellow at the Wellcome Centre for Cultures and Environments of Health at the University of Exeter. Fred's a historian whose work looks at loneliness, shame and care, and the ways in which loneliness has in recent times become cast as an issue of medical concern. And he's going to make the case for a nuanced understanding of the cultural contexts that influence the ways that we think about and respond to loneliness. So Fred, over to you. Thank you.
Thanks, Felicity. So what I'm going to briefly do today is give a kind of in-progress report about ongoing research into the cultural context of loneliness among young people in the WHO European region. So I've been leading on this work, but working in collaboration with Dr. Charlotte Jones, the sociologist of gender, sexuality, disability and health, Professor Manuela Barreto, the psychologist of marginalisation, stigma and social relationships, both working with me at Exeter, and Professor Pamela Qualter, a psychologist of education and expert in childhood loneliness at the University of Manchester. So we begin from the position that loneliness is conditioned by culture. Isolation and exclusion have negative physical and mental health outcomes across cultures, with evidence suggesting a global need to belong, communicate, relate, care and be cared for, and to be useful and significant to others. So health is relational in every cultural context and across every demographic group. What culture does is frame and govern who becomes lonely, when, why, and how, the ways in which loneliness is conceptualized, articulated, and experienced, the consequences of acute or chronic loneliness for health comorbidities, and the success or failure of specific policy interventions, whether local, regional, or national. So recent research, including the BBC Loneliness Experiment led by Barreto, Kolta, and Christina Victor, points to a U-shaped curve in the distribution of loneliness across the life course, with children, adolescents, and young adults seriously affected. Although evidence on causal patterns between loneliness and poor physical health is stronger for older adults, involving complicated relationships between isolation and poor nutrition, or low levels of social support and reduced health-seeking behaviour, it's less clear how these concerns play out among younger demographics. What the evidence does show are clear connections, often complex and cyclical, with depression, anxiety, suicide, self-harm, alcohol and drug dependency or misuse, and other iterations of risk-taking behaviour. So we're working from the WHO definition of young people as between the ages of 10 and 24, which allows us to capture quite a broad spectrum of interrelated experiences. In terms of culture, our work has been guided by the landmark report Culture Matters, led by David Napier, which drew in turn on the 2001 UNESCO definition. So these offer a complex definition of culture, including lifestyles, ways of living together, value systems, traditions, and belief. And they stress that national, religious, or ethnic affiliations are only part of the picture. To frame and inform effective evidence and interventions, policymakers have to adopt a complicated and multidimensional imagining of what culture is and how it works. So loneliness is probably even harder to adequately define. For the sake of this work, we're kind of taking it to apply to a broad constellation of emotions, behaviours, and experiences, specifically around a felt and hurtful lack of fulfilling, supportive, and rewarding relationships. As the WHO European region includes 53 countries, there are extensive linguistic differences in how proximal words to loneliness carry and shape meanings. In the introduction to their recent special issue of Transcultural Psychiatry, Chikako Azawa de Silva and Michelle Parsons make the point that, and I quote, "The English term loneliness and its direct equivalents are not the only terms through which we can explore feelings of not being socially connected or of feeling abandoned. One caveat to this is that direct equivalents aren't always that direct, but they carry their own specific heft, inflection, and nuance. To take two examples, and with apologies in advance to native speakers, in the Italian language, solitudine is an ambivalent word which corresponds roughly to either the negatively weighted English word loneliness or the more positively weighted English word solitude, depending on how it's used. Equally, the Russian word одиночество is almost always completely negatively weighted. So research into meanings with native Russian speakers has demonstrated how widely used proverbs and idioms reproduce this negative weight, creating linguistic and literary cultural contexts which govern the ways that being alone is thought about, experienced, and acted upon. Even perhaps especially at the level of language, culture frames the whole equation. How the problem is articulated is not a trivial or a cosmetic question, but a profoundly meaningful one. As the sociologist of youth and leisure Ken Roberts put it in 2001, we delude ourselves and blink at the search for policy solutions when we universalise our domestically generated social science. Resisting universalisation is particularly important, we argue, when addressing the needs of demographic groups usually understood to be navigating distinct and predictable developmental and psychological challenges. To give one example, adolescents in particular face considerable tensions between individuality and conformity, transitional identities, bodies and behaviour, and intimacy, belonging and distance in peer groups, work and educational contexts, and families. Differing considerably across the WHO European region, distinct historical and cultural processes can lengthen, accelerate, or distort these common developmental challenges, place them under unfamiliar and harmful stresses, and introduce external complications which make loneliness much more likely. The idea of a transitional transition, developed by Smilka Tomanovic and Suzana Ignatievich in their exploration of Serbian youth culture, is a useful one. It pushes past overly simplistic and often outdated or poorly informed conversations about individualistic versus communalistic cultures, recognizing that all societies are always in a state of change. So young people's transitions to adulthood take place within broader cultural shifts, which are always incomplete and always unevenly distributed and experienced. Nations probably contain too much cultural and experiential variety to consistently work as a coherent unit of analysis. Evidence on local, geographical, and institutional context for loneliness is more important than ever. These contexts also govern the extent to which universally meaningful identities, factors, and experiences, such as sexuality, ethnicity, religion, racialization, urban or rural environment, gender, disability, physical and mental health, poverty, caring, estrangement, unemployment, or migration can result in loneliness when mediated by shame, stigma, and social, legal, or civic exclusion. Just to conclude, loneliness was a pressing public health issue before COVID-19. Emerging evidence suggests that young people in the region have found government regulations during the pandemic particularly isolating. They've also been among the populations hardest to reach with public health messaging. The themes I touched on today are a vital context for these social, psychological, and behavioural challenges. In turn, when COVID-19 recedes as a global virological crisis, the interlocking cultural and relational legacies of the pandemic and how young people in the region experience, navigate, and interpret them will condition and frame new contexts for loneliness, which we will have to analyse, understand, and intervene in. Thank you.
Thank you, Fred, very much. That was very, very interesting and insightful, and we'll come back to some of the points you've raised when we have the discussion later. Our next speaker is Vivian Barnacle, who's currently a freelance consultant, but prior to this worked as the Programme Manager for Child and Adolescent Mental Health at WHO Europe. And Vivian is going to talk to us about her work around loneliness with school-aged children across different parts of the region. And just before she starts, I just wanted to say that Vivian has to leave a little bit early at the end of this session, so we will try and direct questions to her earlier on. Thank you, Vivian.
Thank you very much, dear everybody. I think I would like to start by emphasizing what was already mentioned but needs to be repeated. I think that loneliness is definitely not a new phenomenon in either population group. In the description of this webinar, it was stated that loneliness is found in very many population groups, and emphasizing and that it's not just the older part of the population that suffers from loneliness, even though that might be the part that we often see advertised in media. We have many more singles in society, some by choice, some definitely not by choice, and numbers of one-person household is growing, especially in cities. We know that loneliness can easily lead to low self-esteem, decrease in mental well-being, and in some cases, even to suicide. With regards to suicide, it is very low when we talk about adolescents, especially under 14, but we actually see an increase by age during adolescence with a threefold more frequency among boys than among girls. So why am I saying this when we are focusing on children and adolescents? Well, because that period in life is an important stage for both mental health and well-being, and therefore it is closely linked to loneliness. We have always, during history, seen children, adolescents, and young people experiencing loneliness. And we know that loneliness that comes from that period of life continues into adulthood. So therefore, when we talk about lonely population groups, we have to start by looking at what is going on during childhood, adolescence. If we take some examples from a school, and even those of us who have not been in schools as active members of a school society for many years, will remember that children in classes with no friends, that we have children in physical activity sessions that were always selected as the last one for sport teams activities. And we also have a group of children that, because of disabilities, have no access to neither schooling nor other vital parts of society activities. So that is known for centuries. And in addition, over the last couple of centuries, we have an increasing use of electronic media for communication and social relations instead of face-to-face. And that in its own right can definitely generate loneliness. In addition, we now have a crisis called COVID-19, and it is obvious with the partly lockdown or the total lockdown of societies with no opportunities for physical or social interactions, the increase in loneliness must be very, very high. We don't have data for it over these last 11 months, or at least I haven't seen, but I'm sure that there are a lot of universities collecting data, and we will be able to use that to analyze what happens when we have a situation like this one. And this is, of course, not a normal one. If we look at protective factors for children and young beings, we do know that liking school is a very protective factor, and having good relations with families and peers are also protective factors. So in the next couple of minutes, I'm going to report back from the Health Behavior in School-Aged Children survey, which is a survey that is conducted in 54 countries in Europe and has been carried on since 1986. And it is an analysis among the health and well-being of the 11, 13, and 15-year-olds in these countries. The data I'm going to present to you is from the latest report that was published in May 2020, and it was based on the 2017-18 survey. Some of the indicators in this survey that are linked to loneliness in adolescence and further on in lives are the ones that I'm going to touch upon. But we can start by saying that social well-being generally is higher among boys and girls from high affluent families. And already there we have introduced the issue of inequity in also the issue of loneliness. Social support is extremely important. Most adolescents report high family and peer support, but levels are generally lower among adolescents from poorer families. Over 2/3 of adolescents report high levels of family support and easy communication with their parents, also a very protective factor. Generally, adolescents find it easier to communicate with their mother than with their father. We know that only 50% of 15-year-old girls finds it easy to talk to their father about things that bother them. So again, a gender issue. Perceived family support and easy communication with parents is declining with age. Over half of boys and around 2/3 of girls report high peer support, but the proportion of adolescents reporting high peer support has actually been declining since 2014. So even though it's still high, it is not on the rise, but the opposite. If we go to areas such as online communication, and as I mentioned before, it is a crucial issue, both for loneliness, but also for improving communication in this part of life where we have the COVID issue. Girls are more likely than boys to communicate with friends online, and they have higher levels of problematic social media use. We know that 35% of adolescents use electronic media to communicate with almost all times of the day. 7% of adolescents report problematic social media use, and boys are more likely than girls to report a preference for online communication. From the mental well-being perspective, again, we have an equity issue because boys and adolescents in general from more affluent families are more satisfied with their lives and report better mental well-being. And reporting this is not an indicator of high loneliness. We know that over 1 in 10 adolescents have been cyberbullied at least once in the last couple of months. That is also a high indicator of low self-esteem and loneliness coming up. Later on in life, when our adolescents, or rather young people, leave home and move away to go to universities and other education institutions, we see an increased rate of loneliness. In some of these institutions, they have good programs for welcoming and integrating newcomers. They have buddy systems. You have students staying in communities where they can interact also out of the studying life. But we also have groups of young people that are leaving home and moving away to start work. And that is much more complex because we don't see the same kind of unified or well-experienced approaches to integrate. And loneliness is more likely to be very high in these kind of groups. So what can we do for children and adolescents to build up a high self-esteem already in the years of adolescence so that their empowerment, their qualifications, their instruments to avoid loneliness in later life can be enhanced? Well, from the education sector, we use very much health promoting school approaches. We try to create supportive environments and we focus on the active involvement of children and young people. We use health promotion actions. We try to empower the young people. I think this is our best answer from a setting where in this region, among 95 and 98% of our youngsters are actually present in school. It is a very good opportunity to provide support and in collaboration with parents to ensure that loneliness is not on the rise, but definitely rather on the low side. Yesterday, we had a high-level meeting where 53 member states were invited, both ministries of health and ministries of education, and we were focusing on schools during COVID-19. And the recommendations from the regional director, Dr. Hans Kluge, was very clear. Keep schools open in this period where loneliness is definitely an issue. And the quotes are from the different participants that schools are an essential part of society and children's lives and health, and closing schools should always be a last resort in efforts to control the pandemic. So with these words, I would like to finalize my presentation. Thank you.
Thank you very much, Vivian. Our final speaker today, I'm delighted to welcome Lena Zachrisson, the founder of Ensamhetsrevolutionen, which I've probably pronounced terribly, and Lena will be able to pronounce it properly. The loneliness revolution in Sweden, which works towards reducing loneliness at home and work. And she's going to talk to us about how we can create more meaningful connections in an increasingly digital world. Over to you, Lena. Thank you.
Thank you, Felicity. That was good. Ensamhetsrevolutionen is the right way to say it. Yeah, I just want to add something about culture. And there's this yearly survey that's called the Expat Insider, and they investigate how it is to live and work abroad. And there's this question there that's called finding friends and socializing, how easy that is. And unfortunately, Sweden and especially Stockholm end up in the bottom of that list every year. And it's 66 countries in there. And I think that people in Sweden, we're not I don't see that we are unfriendly in some way, but I don't think that we have recognized the importance of those small talk, everyday small talk that we do. We actually call it cold talk or dead talk, and we can be much better at that. But concerning young people, I was in a panel last year who showed that 25% of young people experience life as lonely, and they did a follow-up thing during the COVID, and 50% of our young people experience their life as lonely. So that's of course a huge number. So I tried to think of what are we spending our time on nowadays, and I realized that 3 or 4 hours a day we are on our phones, and we use them for Facebook, text, Snapchats, Instagram, and stuff like that. And I asked myself why don't we call each other anymore? So I wanted to create something that was like a little bit like more back to basic. So one of the things that we do in the Loneliness Revolution is a process called the buddy loop, and it's for it's either for like neighborhoods or colleagues, basically where people are. We live somewhere and we work somewhere. So it's a 3-week process, and we meet online 4 times, and we talk about sense of coherence there. And I talk about the importance of having a sense of belonging and facts about loneliness, of course. And in the first meeting, everyone gets to choose their own like agreement, something that they are going to do for 21 days. And it's going to be something small, and it's going to be their choice. So everyone has, you know, something that they want to do or not doing. So it could be like doing 20 push-ups every day, or read for 10 minutes, or say hi to a neighbor, interact with someone. And the key here is progress, because I believe that if we like move forward on like a right path, there's so much good that comes out of that. It's like a ripple effect, like you're being proud of yourself and you're honoring your word. And it sounds easy, but doing 20 push-ups every day for 21 days, it's easier said than done, of course. So therefore we pair up. So one-on-one, we call each other every day for 7 days. And that's amazing, because talking to the same person for 7 days, the call doesn't have to be long. It's like, how are you? Have you done your agreement today? And we support each other. And something happens after talking to someone that you like barely knew before. Something happens there. And I mean, it could be a little scary to call someone that you didn't like know that much from the beginning, but we're all in the same boat, and that's a part of the process. And we have guidelines for it. And then we rotate after 1 week. So during this period, you get to know 2 new people, basically. So this is one example how to like raise awareness about loneliness, like in a more like fun way, hopefully. And it's about empower people, as Vivian said. I mean, just even to call someone could be a little scary, and hopefully get new connections. So the method in this is built up. It's structured, it's manageable, and it's meaningful, because everyone does what they want to do. You choose your own agreement. And it's I just finished one of these buddy loops with a company, and you got to be like even pairs. So if they're not, I join in, which is amazing to be a part of. And there was 1 week I talked to a girl, we can name her Anna. She was new at her workplace, and I think actually also new in town. And she was in this like transition from studying and like being an adult. And she specifically told me that she was so grateful and that we talked about loneliness during this session. And she could see that she had like, when she looked at her older relatives, she could see that there were 2 different types. One of them were like more social than the others. And during the pandemic, she could see that she had like a tendency to isolate herself. And she realized that she could end up like lonely if she didn't like change her behavior. And it was such an important insight for her to get. And it was so beautiful to hear her share it with me. And her agreement was, of course, to interact with someone every day. It could be say hi to your neighbor, or call an old friend, or something like that. And that is just like one example how to raise awareness, like in an early stage to prevent loneliness. And I think that I think everyone can help, and we make a difference together. And I don't like specifically, my target audience is lonely people. They not always easy to find, and we all live or work somewhere. And I think the problem with loneliness is something that we like all need to act up as human beings and as a society as a whole. Thank you.
Thank you very much, Lena, for telling us about the amazing work that you are doing. Thank you to all of our speakers. I want to bring all of the speakers back together now to start a discussion. We have some questions and comments that have come in on Slido. So the first one I wanted to ask comes from Pamela Coulter at the University of Manchester. And Pamela says that in recent work, we found that adolescents reporting high loneliness did not feel able to talk to parents or teachers, and that adults often dismiss loneliness. I just wondered if you could comment on how that resonates with what you found in your own work. Vivian, do you want to go first on that one?
Yeah, well, I think it might even be building on the HBSC survey, because it seems to resonate very well. I only took bits and pieces out, but it's very obvious that there are some issues here in relation to the communication with family, as I also mentioned, that shows that kind of communication is vital. And we see also, if we go in and do an analysis of not only gender, but also on level of society, then it is actually obvious that from the more affluent your family is, the better communication you have, and the lower loneliness or other symptoms of uneasiness we can spot. So I think this research fits perfectly into the findings of the HBSC from this latest round.
Thank you. And Fred.
Sorry. Yeah, that's really interesting. It's one of those things I worry that that it can be seen as something that's in some way like necessary or like formative, that it's like a part of growing up, or that it's like, oh, like a part of like adolescent moodiness or something like that, that can be kind of dismissed as sort of being relatively predictable and not too harmful. I also think it's quite interesting to think about, obviously, the stigma of admitting that you're lonely is quite a kind of a difficult one. But there's also that problem is when you can get past that and you admit to someone that you're feeling really lonely, it's almost, or I think it can be experienced by other people as being almost quite a judgmental thing. Because, I mean, if you think about the people you're most likely to open up to, they're the people who you're probably closest to. And so if your child tells you that they're lonely, in some ways that can be a kind of experienced as a comment on your own relationship. I mean, if you tell your friends that you're lonely, then there might be that kind of assumption that they're not being a good enough friend. It's a really, really difficult thing to disclose. And it's probably a really, really difficult thing to hear from people you care about, because your own behavior and your own relationship with them is completely implicated and bound up in that, even though it's not your fault. But it's a really difficult thing to hear, I think.
Thank you, Fred. That's a very interesting point, I think, and maybe we can come back to that in a minute. Lena.
Yeah, I want to continue with what Fred said, that the stigma around it. And I think the more we talk about it, I mean, there's so many of us that experience loneliness, and you can be lonely in so many ways. You could be like socially excluded, but you can also like have this feeling of loneliness. And we all in here in this room, we know facts and figures about these things, and we know that it's very, very common, but out there people doesn't like know how common it is. So even to like raise awareness, to start talking about that's like a first thing, I think, because we can change it. Like there's the feeling of loneliness, you can get it like instantly. You can also change it like pretty easy if it's hasn't like gotten that far yet. Yeah.
Thanks. I mean, I just wanted to sort of follow on from that, really, to ask about, well, when adults dismiss loneliness, are people like teachers actually, firstly, are they trained to actually respond to loneliness if they see that within their schools? And secondly, where does responsibility lie for loneliness? I know that's a much bigger question, but it would be really interesting to hear people's thoughts on that. Vivian, are you okay to go first on that one?
Yeah, I'm fine. Well, if I start by the last one, responsibilities, I think whenever you talk about responsibilities, in an issue like this, you can easily end up blaming, and that's probably not what we want to do. When adults dismiss loneliness, well, if I can go back to the example again. If you have good communication with your parents, you're not likely to be lonely, and you're not likely to suffer from loneliness. If you are suffering from loneliness, it would be helpful if you have a teacher that actually notices you. But in general, it is not the kind of education that you would receive at teacher training colleges. It's very much based on content of subjects. So in many cases, what could be recommended was that some kind of additional training for actually acknowledging the way that children and young people act in social context is essential. And especially for teachers, because as I mentioned, this is the setting where we meet all the children. And it is a setting where there is a good opportunity and probability of being able to help children that suffer from loneliness or other problems that they don't feel that they can convey to their parents or to the few friends that they might have. But I think we need probably to focus on a lot of extra training of teachers to realize their potential in being able to support children in that part of growing up as well. Over.
Thanks. And Fred and Lena, I'm wondering how that plays out for older young people. So Fred, if you could talk about that briefly in the university setting, and Lena, how that plays out in workplace settings. Fred?
Yeah, sure. It's really difficult. I'm always kind of thinking of as Felicity said, I'm a historian by training. There's this fantastic line from, I think, some work on loneliness in the 1950s in Britain that's about this kind of like the front line of who actually deals with loneliness, and it being, you know, GPs when people come in with imaginary complaints, it also being, you know, people who run bars, librarians, teachers, kind of all of these kind of like completely untrained people who are actually kind of dealing with it in reality. Yeah, in the university context, it's really difficult. I mean, I think it would be absolutely fantastic if everybody's lecturers were able to be thinking about their health, about their mental health, about their relational health, and able to kind of identify, reach out and support. I'm also kind of aware that it's an absolutely massive ask of people who are already kind of really overloaded, and I'm sure that's true in a lot of contexts with teachers too, is that you can ask people to be doing and kind of thinking and responsible for so many different things. But yeah, it's something that I think like a kind of much greater awareness of would be really, really useful. But then, I mean, it's kind of part of a bigger context in which organizations are often really under-resourced. So that kind of translates into a kind of less caring reality than would really be helpful. And I think that's, again, always going back to kind of culture, that ties in with institutional cultures around kind of caring and safety and harm and things like that too.
Thanks, Fred. Lena?
Yeah, I think, I mean, I think that like where we live and where we work, that's where I do my work with the loneliness revolution. And basically because there's someone who, like, there's a property owner or this workplace, so I can talk to them and inspire them to widen their perspective and take responsibility for the employees or their tenants, as an example. And I think there's a lot to do at our workplaces, because work is also a very big part of our life, and that's where you have one of your sense of belongings. And especially now during the pandemic, all of a sudden everyone became lonely because everyone has to isolate ourselves. So I think that's a good start, but we can be much more better at it and address the issue. And we're pretty good here in Sweden to address like physical health. And I think we have to focus more on this.
Thank you. Somebody has asked whether do we experience loneliness differently across age, socioeconomic status, space, and time? I think we've touched on that to an extent, but the second part of the question is, are we all in it together? And I guess one thing that throws up for me is that actually, when you do the loneliness surveys and you collect data in these ways, are there certain people in the population who are more likely to say that they're lonely? I mean, is that actually an accurate reflection of what's really going on, or are some people more likely to say yes because of possibly other contextual factors, like is it a generational thing to say, to be able to admit to being lonely? You know, I'm thinking about the happiness surveys that get done, and we know that there's that cultural context plays a huge part in the way that people report their well-being in that kind of survey. So do people think this is also happening here in the way that loneliness data is collected? Any comments, any thoughts?
Well, just very briefly, I mean, when you do surveys, the formulation of indicators is always an issue, especially if you start off doing it in English and then start translating into, in the case of HPSC, more than 53 different languages. And we heard from Fred, I think, I mean, we have issues every time how to translate, and just use the word loneliness wouldn't happen, because we would rather go into using a number of indicators to show whether loneliness is something on the rise or on the fall, instead of just asking the question directly, do you feel lonely? All the time, some of the time, or never. Because the definition is, I mean, in my own language, loneliness is a negative word and there is a positive word, but in other languages, it might be the same word. And how do you then reflect? So short comment is that just asking whether you're lonely or not doesn't really give a true picture. And asking whether you're happy or not doesn't give a true picture either, because happiness is constituted by quite a number of different issues. Over.
Yeah, thanks, Vivian. I just want to follow that up with Fred with another question that's being asked here, which is, do the ways that we talk about loneliness shape the way that we experience loneliness? So could you just sort of unpack a little bit more what you were saying earlier, Fred?
Yeah, absolutely. To quickly kind of address the other ones. No, I don't think we're all in it together. I think it's a really different experience, and I can kind of bring in stuff about linguistic differences and how loneliness is kind of framed and thought about in there as well. But no, I mean, I sometimes worry about the integrity of loneliness as a word that covers all of these different experiences. So, I mean, when we're talking about kind of loneliness amongst young people, I mean, there are all sorts of things going on there that we've kind of talked about in different ways, you know, that kind of transition to adulthood, navigating all of these things, kind of trying to pull apart from parents in some ways and find friends. If you're thinking about old age loneliness, there's all sorts of things in there that just aren't in the mix, like boredom, grief, feelings of like uselessness and helplessness. I mean, in some ways, it's just such a different experience. And then I think kind of like going across cultures, yeah, the words we use and the kind of way we think about it, I think completely colours everything. It's really kind of how you end up building your life world. So, I mean, I'm thinking about, I mentioned them briefly, but some of these kind of idioms and expressions in Russian that kind of center on loneliness. And these are things that are kind of being repeated that kind of like form a part of this kind of world for people. And so it piles on these kind of associations in really, really interesting ways. And then if that's the way that people learn to structure their own feelings and experiences. So nothing is ever kind of consistent. It's always going to be how you understand, experience, and kind of frame your own feelings in any context. And language and culture are absolutely enormous parts of that. I just to jump onto one other thing. I do think sometimes that there is, in terms of finding out who feels lonely, I think that there are different kind of thresholds for loneliness or for identifying yourself as feeling lonely. And there are different expectations as well. So working with young people who have considered themselves to experience loneliness, so many times they talked about the expectation to be popular, to be kind of having lots of friends, to be constantly like hyper social, particularly in a university context. And that just isn't present in older age. People have fewer and fewer friends usually. I think there's so much language around loneliness in old age that many people quite probably expect to be a little bit isolated in some ways. So actually, there are things that kind of can be normalized in some contexts, but then also stick out like a sore thumb in other contexts, because everything is messaging that you should be acting and behaving and experiencing things in a certain way. So I think it's a completely different equation for different people. Sorry, rambling.
No, I think that's great, Fred. Thank you. And I think it also helps answer another question that we've got around whether or not we're socially conditioned to assume loneliness is always a negative or harmful thing. And I think that part, you've partly answered that by what you've just been saying. Another question that's come up is around why there's so much focus at the level of the individual and the sort of pedagogical efforts at schools through to psychological interventions, which all focus at the level of the individual, and the individual being the person that needs to be fixed in these kinds of instances. Lena, can I ask you to kick off that conversation, please? Oh, you're on mute at the moment.
Yes, can you say it again? Sorry.
Yes, it was just saying that when we conceptualize loneliness and think about how to fix loneliness, we're often thinking about fixing at an individual level rather than at a broader societal level.
Yeah.
Whether or not that's something that resonates with what you find in your work and what we can do about that.
Yeah, I think we need to work on it from both sides basically, because if the problem is this big, then we need to act on it as a society. But there's of course always, I mean, the individual is the only one who can like start to like do stuff for themselves. But so I think we should work from both like sides. But as big as the problem is right now, I think we need to act.
Thank you, Vivian.
Yeah, from the school's perspective, I mean, what you do is you identify an individual being lonely, but the treatment or whatever we want to call it is more a collective one, because you can't treat loneliness in an individual without involvement, and involvement means that you are working together with, in the school, for instance, the class itself, and you don't identify the person being lonely, but you set along activities that means that the people, the youngsters, involve themselves, and you don't have anybody standing outside. So that's one way of having an individual problem, but moving it into a collective solution. Over.
Thank you, Fred.
Yeah, it's in some ways it's this kind of like classic and sort of very old tension between, like, I'm thinking of like Marxism and psychoanalysis, where, you know, the big question of, do you change people and then that changes society, or do you change society and then that changes the people? I mean, my instinct is usually to go with these big like political, structural, cultural questions, But I think one of the reasons there has been so much focus on the individual is because loneliness it can be such a personally changing and altering state. So it makes you put up barriers. You could, if someone has been very lonely for a long time, you can change society as much as you want, and they still won't go to whatever kind of, you know, meet and greet event you've put on, or kind of the community centre or something like that, if they've turned inwards on themselves and got to the point where they don't even want to connect with people. So it's something that is really, really individually psychologically significant, I think, in terms of just how strong a hold it can have on people's everyday experiences in their lives. And people build up so many barriers that the social political side of things sometimes just can't penetrate through. So yeah, I think you have to be mindful of both. But considering that there has been so much focus on the individual, it's definitely time for a lot more focus on those broader patterns and structures too.
Yeah, I mean, I think it's there's definitely something to be said for considering structural barriers that stop people from getting involved in initiatives as well, rather than assuming that everybody is able to participate in the same ways in society all of the time. I have a question here on whether different countries have different rates of loneliness and whether we can explain that through culture. I think Vivian's had to leave us now, but Fred, perhaps you could comment on that from your recent research.
Yeah, sure. They absolutely seem to. There are all kinds of, I mean, it can be really difficult to kind of get really good data. I mean, people use so many different types of questionnaire, all sorts of different types of means of finding out about these things, which are never uniform. It seems like there are kind of wild variations. People often try and talk about whether that particular kind of culture is a communalist or an individualist one as a kind of explanatory factor. People argue about which is worse, about which kind of causes more loneliness. I probably think they just cause loneliness in different ways and for different reasons. But yeah, I think you can definitely say that, broadly speaking, cultures, when they do produce loneliness, do it in different ways and for different reasons and through different mechanisms.
Thank you. Lena, there's been quite a bit of interest in your work in the questions. So if I can just direct a couple of slightly more specific questions towards you. One is, any reflections on how the connections have continued after the initial contact? And secondly, how do initiatives such as yours help lonely individuals form meaningful connections independently? So after your intervention is gone.
Yeah, there was one reflection, like in the end of the session that we had with this company that we just finished. One of them was like, what are we going to do next? Because and I thought that was like a really good thing, because that means that you start to change something. You already create a habit that you want to continue with. And one of the girls that I talked to, we still have a little bit, we chat sometimes. So I think that's a start. But when I'm doing it for like companies or for tenants, you always have to do it. It doesn't have to be mandatory, but if some people start, then others can follow. And as I said before, like I don't target lonely people, but I think since the matter is so huge, we tend to spread it. So I think that's the start of something. Did I answer the second question?
The second question, I think, was how, just how did people carry on these connections independently after you have taken a step back?
I mean, I think some of them do it on their own. And that's so beautiful, because there's nothing more. I mean, it's call each other every day, and you can continue to do that if you want to. But the tendency among us is that we stop. So that's why I did this whole process. It's very structured. and we have it over 3 weeks. So, and I think we live in a world with a lot of information. We all know how we should eat or train or work out or stuff like that. But the key here is that you get things done, and it's not big things. It's kind of a little of a game, but it's not a competition, because everyone does the thing that they want to do that is meaningful for them.
Thank you. Just quickly before we finish, there's a question from Nicolene Felding from the Rockwool Foundation, who's asking, is there any science that shows the root causes of loneliness with people who are surrounded by people every day? Fred or Lena, are either of you able to comment on that question?
Yeah, sure. The root causes of loneliness among people who are surrounded by people. I think there's certainly a lot of literature on depression and people's experiences of depression, and how people can often feel completely cut off from people, even when kind of from the outside they seem to have kind of really fulfilling relationships. I suppose that kind of also comes back to who are the people they're surrounded by, and what that kind of quality and level of interaction is too. Yeah, it's a really kind of complicated thing. I think loneliness certainly doesn't map on cleanly to observable isolation, in the sense that many kind of isolated people aren't necessarily lonely, and many people who aren't isolated at all do feel and experience loneliness. But there can be kind of mismatches in things like values or identities and all sorts of things which kind of can produce those feelings.
Thank you, Fred. Lena, do you want the last word on that?
I mean, it's alone in the crowd. I mean, it's so much easier to experience loneliness when you're surrounded by people, but still like don't feel that you have a connection with them. So, and that's of course, loneliness is more like spread in like urban areas, because you're so close to other people, but you don't feel connected. And just by starting like finding those like small, starting with your small talk and see people around your street or in your neighborhood, that's like a very good start to having a more like connected, like everyday life.
Thank you. In 30 seconds, Fred, have there been learning from COVID that we can take forward, useful learning? And what is it?
Yes, I think so. Basically, I think that when something becomes a huge enough problem in the public consciousness, people start to rally around and do some really interesting things. There's been so much interesting work on mutual aid during COVID. I worry that when the problem recedes and loneliness is only happening to a certain percentage of people or a certain type of person, that the kind of big public will to be so engaged and useful won't necessarily be there. But I think the lessons are there if we want to take them, and if we have the kind of will to take them.
Okay, that's fantastic. Thank you very much for that. So I think we need to finish at this stage. Just a plea to everybody to please fill in the evaluation form, which is available under the polls section on the Slido box. I'd like to thank our panel members, Fred, Vivian and Lena, and the audience for what's been a really fascinating and thought-provoking discussion. So thank you, everybody. I just want to wish everybody a very happy festive season, best wishes for the new year, and what we all hope is going to be an easier, less stressful and hopefully less lonely 2021. And please keep an eye on the website for future seminars from the WHO programme. Thank you, everybody, and goodbye.
Thank you.